I want you to take a moment right now, just a moment, and think about whether you've ever felt your hands or feet going cold for seemingly no reason. Maybe your legs feel heavy after a short walk. Maybe you've noticed that one of your feet tingles when you sit still for too long, and you just brushed it off as your leg falling asleep. Or maybe, and this is the one I really want you to pay attention to, you've noticed a slight swelling in your ankles by the end of the day, and you've just been chalking it up to standing too much, or eating too much salt, or just getting older. I want to tell you something today that I genuinely believe could change the quality of your life, maybe even save it. That symptom, that subtle, easy-to-dismiss ankle and leg swelling, is one of the most overlooked, most misunderstood, and most critical warning signs of poor circulation that millions of people are ignoring every single day. And I'm not saying this to scare you. I'm saying this because I've seen what happens when people ignore it too long, and I don't want that for you. Today, I'm going to walk you through everything you need to know about poor circulation. What it really is, why it happens, what your body is trying to tell you, and most importantly, what you can do about it starting today. This isn't going to be a list of symptoms rattled off like a textbook. I want this to feel like a real conversation, the kind you'd have with a doctor who actually has time to sit down with you and explain things properly. Because you deserve that. You deserve to understand your own body. Before I go further, I want to ask you something, and I genuinely want to hear from you. Have you ever experienced swelling in your legs or feet, or a cold, numb, or tingly feeling in your hands or feet that you just ignored or pushed to the back of your mind? Drop it in the comments below. Just tell me what you've noticed. You'd be amazed how many people are dealing with the exact same thing and have no idea it's connected to something as significant as circulation. Let's get into this together. So let me start at the beginning, because I think to truly understand why poor circulation is such a big deal, you need to understand what circulation actually does for you. Your circulatory system is, without exaggeration, the lifeline of your entire body. Every single cell in your body, your skin cells, your brain cells, your muscle cells, your organ cells, every single one of them depends on your blood to deliver oxygen and nutrients and to carry away the waste. Your heart is the engine, your blood vessels are the highway, and your blood is the delivery system. When that system works perfectly, you feel it. You feel energized, your skin looks healthy, your brain is sharp, your muscles recover well, your digestion works smoothly. Everything just hums along. But when circulation starts to falter, when the blood isn't moving as freely, as efficiently, as powerfully as it should, things start to break down quietly. And I mean quietly. That's the tricky part. Poor circulation doesn't always announce itself dramatically. It doesn't always come with chest pain or collapse. Often, it sneaks up on you in ways that are so easy to dismiss, so easy to attribute to something else, that people live with it for years, sometimes decades, without connecting the dots. And in the meantime, the underlying problem gets worse. The number one symptom I want to talk to you about today is edema, particularly in the lower legs and ankles. Now, edema is just the medical word for swelling caused by fluid buildup in the tissues. And here's why it happens when circulation is poor. When your blood isn't circulating well, it starts to pool, particularly in the lower extremities. Gravity pulls it down. And as the pressure in the blood vessels increases because blood is sitting there instead of moving, fluid leaks out of the vessels and into the surrounding tissue. That fluid has nowhere to go. It just sits there, causing your ankles, your feet, maybe even your calves to puff up and feel heavy and tight. Now here's what makes this so easy to ignore. Mild swelling at the end of the day is incredibly common. Almost everyone experiences it at some point. You stand all day, your ankles swell a little. You sit on a long flight, your feet swell. You eat a salty meal, you retain a bit of water. So when people notice this happening, they almost always explain it away with something benign. And sometimes it is benign. But here's what I need you to understand. If this is happening to you regularly, if you're noticing puffiness in your ankles or lower legs on most days, especially if it's getting worse over time or accompanied by other symptoms, that is your body waving a flag. A red flag. And the fact that it's easy to explain away is exactly what makes it so dangerous. Let me paint you a picture of how this actually plays out in real life. Someone, let's call her Maria. She's in her mid-50s. She's a busy woman. She works, she takes care of her family, she's always on the go. She notices that her ankles look a little puffy in the evenings. Her feet ache. She's a little tired. She figures it's because she's been on her feet all day. She buys some compression socks because someone at work mentioned them. Maybe that helps a little. She doesn't make a big deal of it. She doesn't mention it to her doctor because, honestly, it doesn't seem like a big deal. She's busy. She doesn't want to be a hypochondriac. Months pass. A year passes. She starts noticing that the swelling is worse. It's not just in the evenings anymore. It's there in the morning, too. Her shoes feel tight. She feels short of breath when she climbs stairs. And then, one day, she goes to the doctor for something completely unrelated, and the doctor takes one look at her legs and says, "We need to talk about your heart." Because that swelling that she'd been ignoring for over a year, it was a sign that her heart wasn't pumping blood efficiently enough. That fluid that had been accumulating in her tissues was a direct consequence of the heart struggling to do its job. She had early-stage heart failure, and it had been whispering to her for a long, long time. I'm not telling you Maria's story to scare you into a panic. I'm telling it because it's real. It happens. And it happens because we live in a culture where we're so used to pushing through discomfort that we've lost touch with the signals our bodies are sending us. Your body is always communicating with you. The question is whether you're listening. Now, let me be clear about something important. Edema, swelling in the legs, can have many causes. Not all of them are as serious as what Maria was dealing with. Some are quite manageable. But the list of things that can cause it includes some conditions that you absolutely need to know about and address. Let me walk you through the main ones so you can start to understand what might be going on in your own body. First, there's venous insufficiency. This is probably the most common cause of leg swelling related to circulation. Your veins have tiny valves in them that are supposed to prevent blood from flowing backward, back toward your feet instead of upward toward your heart. When those valves get weak or damaged, blood pools in the lower legs. The pressure builds, fluid leaks into the tissue, and you get swelling. This is also what causes varicose veins, those twisted, bulging veins that you might see on the surface of your legs. If you have varicose veins and leg swelling together, that's a strong signal that your venous system isn't working as it should. And venous insufficiency, if left unaddressed, can progress. It can lead to skin changes, discoloration, sores that won't heal, and a condition called deep vein thrombosis, blood clots in the deep veins, which can be life-threatening if those clots travel to the lungs. Second, there's heart failure. I mentioned it in Maria's story, and it's important enough to say again clearly. When your heart isn't pumping effectively, whether because of disease, damage, high blood pressure over many years, or other factors, blood backs up in the system. The right side of the heart receives blood from the body. When it can't pump efficiently, blood backs up in the veins leading to it. Pressure builds, and fluid leaks into the tissues, especially in the lower legs and feet, because gravity pulls it there. This kind of swelling often also comes with shortness of breath, fatigue, and difficulty lying flat without feeling breathless. If any of those sound familiar, please, and I mean please, talk to your doctor. Third, kidney disease. Your kidneys are responsible for filtering your blood and regulating the balance of fluids and proteins in your body. When they're not working properly, they can't filter out excess fluid effectively, and protein can leak into the urine. Low protein levels in the blood cause fluid to shift out of the blood vessels and into the tissues. Kidney-related swelling often appears first around the eyes, puffy eyes in the morning, and then progresses to the ankles and legs. If you're noticing swelling combined with changes in your urination, going more or less often, changes in color or foaminess, that combination deserves attention. Fourth, liver disease. Your liver produces a protein called albumin, which is crucial for keeping fluid where it belongs, inside your blood vessels. When liver function is compromised, albumin production drops. Fluid starts leaking out of the vessels. This can cause swelling in the abdomen as well as the legs. If you've ever heard the term ascites, that's the fluid that builds up in the belly when the liver isn't functioning well. Combined with leg swelling, jaundice, or abdominal pain, this is something to take very seriously. Fifth, lymphedema. Your lymphatic system is a whole separate drainage system in your body, running alongside the blood circulatory system. It collects excess fluid from the tissues and returns it to the bloodstream. When the lymphatic system is damaged, which can happen after cancer treatment involving lymph node removal, infections, or trauma, it can no longer drain efficiently. Fluid accumulates in the tissues, causing a type of swelling that tends to be firmer and less responsive to elevation than other types. Lymphedema can be chronic and requires specific management strategies. Sixth, and this is a very common one, peripheral artery disease, or PAD. This is when the arteries that carry blood to your limbs become narrowed or blocked, usually due to a buildup of plaque. Now, PAD is interesting because it can actually cause a slightly different presentation than venous issues. People with PAD often have legs that feel cold and look pale or bluish, and they experience pain or cramping when they walk, a symptom called claudication that goes away when they rest. Swelling may or may not be present, but the circulation is severely compromised. And PAD is a major red flag for cardiovascular disease overall. People with PAD have a significantly elevated risk of heart attack and stroke. I also want to mention that certain medications, including some blood pressure medications, steroids, hormones, and anti-inflammatories, can cause fluid retention and leg swelling as a side effect. So if you're on any medications and you notice swelling, that's worth discussing with your doctor, because sometimes it's as simple as adjusting your prescription. And then there are lifestyle factors. Prolonged sitting or standing, obesity, a high-sodium diet, physical inactivity. All of these can impair circulation and contribute to swelling. These are also the most directly addressable factors. And that's actually really good news, because it means there is so much within your power to change. Let me talk now about the broader picture of what poor circulation actually does to your body over time. Because I think once you understand the downstream effects, you'll feel even more motivated to take this seriously. When blood isn't circulating properly, the tissues throughout your body are getting less oxygen, fewer nutrients, and less efficient waste removal. That has real consequences. Your brain, for instance, is exquisitely sensitive to changes in blood flow. The brain makes up only about 2% of your body weight, but uses about 20% of your oxygen supply. Even small reductions in cerebral blood flow can manifest as brain fog, difficulty concentrating, memory problems, headaches, and dizziness. Many people experiencing these cognitive symptoms don't connect them to their cardiovascular health. They think they're just tired or stressed, or that their memory is just not as sharp as it used to be. But the connection is real, and it's well established in the medical literature. Your skin is another organ that suffers when circulation is poor. Skin cells depend on blood to deliver oxygen and nutrients and to remove waste. When circulation is sluggish, skin can look dull and pale. Wounds heal more slowly because the healing process requires robust blood flow to deliver the necessary building blocks. For people with diabetes, who already struggle with circulation issues, this is particularly dangerous because poor circulation in the extremities combined with nerve damage can lead to wounds on the feet that won't heal and eventually become infected. Diabetic foot complications are one of the leading causes of lower limb amputations worldwide, and almost all of them are linked to chronically poor circulation. Your muscles suffer too. They fatigue more quickly, recover more slowly, and may cramp or ache. The heaviness and aching you feel in your legs when circulation is impaired is your muscles literally crying out for more oxygen and more efficient waste removal. Your digestion can even be affected. Blood flow to the gut is essential for proper digestion and nutrient absorption. Chronically poor circulation can contribute to digestive issues, including nausea, poor absorption, and discomfort after meals. And of course, your heart itself can be strained. When peripheral resistance is high, when the blood vessels are stiff or narrowed, your heart has to work harder to push blood through. Over time, this extra workload can cause the heart muscle to thicken and become less efficient. That's how chronic hypertension and poor vascular health gradually erode cardiac function. So now you see why this matters so much. Poor circulation is not a single issue with a single symptom. It's a systemic problem that touches every part of your body. And that one symptom I started with, that swelling in your ankles and legs, is often the visible tip of a much larger iceberg. Now let's talk about what you can actually do. Because I believe firmly that information without action is just frustration. I want you to leave this conversation with real, concrete things you can do starting today. The first thing I want to encourage you to do is get an evaluation. If you've been experiencing leg swelling, coldness in the extremities, unusual fatigue, or any of the other symptoms I've described, please make an appointment with your healthcare provider. I know that's not the most exciting advice, but here's why I'm leading with it. The right treatment depends on the right diagnosis. Whether your swelling is from venous insufficiency, heart issues, kidney function, or lifestyle factors, the approach is different, and you need a proper evaluation, including a physical examination and potentially some blood work, imaging, or vascular testing, to know what you're actually dealing with. Don't let embarrassment or the belief that you're probably fine stop you from getting checked. You deserve answers. When you do see your doctor, I want you to be your own advocate. Describe your symptoms clearly. Tell them when the swelling started, how often it happens, whether it's worse at certain times of day, whether it's accompanied by other symptoms. Tell them about any family history of heart disease, blood clots, kidney disease, or vascular problems. The more information you give, the better equipped your doctor will be to help you. Now let me share some of the most powerful things you can do on your own to support better circulation, because lifestyle genuinely is medicine when it comes to this. Movement is the most powerful circulatory tool you have. When your muscles contract, especially the large muscles in your legs, they squeeze the blood vessels and pump blood back up toward the heart. This is sometimes called the skeletal muscle pump, and it's critically important to venous return. When you're sedentary, that pump isn't working. Blood pools and swelling develops. This is why people who sit for long periods, on planes, at desks, in cars, notice their legs swelling. Regular movement activates that pump and keeps blood moving. You don't need to run a marathon. Walking is genuinely one of the best things you can do for your circulation. Even 30 minutes of brisk walking most days of the week can make a remarkable difference in vascular health. If you sit for long periods at work, set a reminder to get up and walk around for 5 minutes every hour. Calf raises. Simply rising up onto your toes and back down while standing can also stimulate that venous pump when you can't walk. Exercise more broadly has profound effects on the cardiovascular system. It strengthens the heart, helps maintain healthy blood pressure, improves the flexibility of blood vessels, and supports healthy cholesterol levels. Even moderate regular exercise, things like cycling, swimming, dancing, yoga, can meaningfully improve circulation over time. If you've been largely sedentary, start gently. Talk to your doctor about what level of activity is appropriate for you. But do start. Start somewhere. Hydration is another underrated factor in circulation. When you're dehydrated, your blood volume decreases and becomes thicker and more viscous, meaning harder to pump. Staying well hydrated helps maintain blood volume and keeps things flowing. Aim for adequate water intake throughout the day. The old rule of 8 glasses isn't universal, but making sure your urine is a light yellow color is a practical and reliable guide. Limit alcohol, which can have complex effects on blood pressure and circulation. Nutrition plays a profound role. A diet high in saturated fat and trans fats promotes the buildup of arterial plaque, the very thing that narrows arteries and impairs blood flow. A diet high in sodium promotes fluid retention and raises blood pressure, both of which harm circulation. On the other hand, a diet rich in vegetables, fruits, whole grains, lean proteins, and healthy fats, particularly omega-3 fatty acids from fish, walnuts, and flax seeds, supports vascular health in measurable ways. Certain foods have been specifically studied for their circulatory benefits. Beets and leafy greens contain nitrates that the body converts to nitric oxide, a molecule that helps relax and dilate blood vessels. Berries contain flavonoids that support endothelial health, the health of the cells lining your blood vessels. Garlic has been shown to have mild blood pressure lowering and anti-clotting properties. Dark chocolate, in moderation, contains compounds that can improve blood vessel flexibility. I'm not suggesting you eat any of these as magic cures, but incorporating more of them into a generally healthy diet is genuinely supportive. Maintaining a healthy weight is also critically important. Excess body weight, particularly abdominal fat, is associated with inflammation, insulin resistance, higher blood pressure, and higher cholesterol, all of which damage blood vessels over time. It also puts additional pressure on the venous system in the legs, worsening conditions like venous insufficiency and varicose veins. Even modest weight loss, 5 to 10% of body weight, can have meaningful positive effects on blood pressure, cholesterol, and circulatory health. Quitting smoking, if you smoke, is without question the single most impactful thing you can do for your circulatory health. Smoking damages the lining of blood vessels, promotes plaque buildup, raises blood pressure, increases clotting risk, and accelerates peripheral artery disease. The damage is real, and it is cumulative. But here's the thing. The body begins to recover almost immediately after you stop. Within a year of quitting, your risk of coronary heart disease drops by half. The benefits of quitting continue to compound for years. If you smoke and you're dealing with circulation symptoms, please reach out to your doctor about cessation support. There are more resources and more options available today than ever before, and you do not have to do it alone. Managing chronic conditions, particularly diabetes and hypertension, is also essential for circulatory health. Both of these conditions silently damage blood vessels over time. High blood sugar attacks the inner lining of vessels, makes blood thicker and stickier, and impairs the ability of small vessels to dilate. High blood pressure forces the heart to work against higher resistance and damages arterial walls. If you have either of these conditions, working with your healthcare team to manage them is not optional. It is one of the most important things you can do to protect your circulation and your overall health. Take your medications as prescribed. Monitor your levels. Show up to your appointments. Compression garments, particularly compression stockings, are often recommended for people with venous insufficiency and leg swelling. These work by applying graduated pressure to the legs, highest at the ankle and decreasing as you go up, which helps push blood back up toward the heart and reduces pooling. For many people with chronic venous insufficiency, wearing compression stockings daily can be genuinely life-changing in terms of symptom management. They take a little getting used to, but many people find significant relief from swelling, aching, and heaviness. Talk to your doctor about whether they're appropriate for you and what level of compression is recommended for your situation. Elevating your legs can also provide symptomatic relief. When you elevate your legs above the level of your heart, by lying down and propping your legs up on pillows, for instance, you use gravity to help drain that pooled blood back toward the heart. This can quickly reduce swelling and discomfort. It's not a cure, but it's a practical strategy that can make a real difference in how you feel. I also want to talk briefly about stress, because it's something that's often overlooked in conversations about circulatory health, and it absolutely should not be. Chronic psychological stress activates the body's stress response, the fight-or-flight system, which causes blood vessels to constrict and heart rate and blood pressure to rise. Over time, chronic stress contributes to sustained high blood pressure, increased inflammation, and a higher risk of cardiovascular events. Mind-body practices, things like meditation, deep breathing, progressive muscle relaxation, yoga, spending time in nature, have been shown to reduce stress hormones, lower blood pressure, and support vascular health. I know it can feel hard to prioritize these things when life is busy, but your circulatory system is telling you to. Taking care of your mental and emotional health is taking care of your heart and your blood vessels. Let me also take a moment to talk about sleep, because it's another underappreciated pillar of cardiovascular health. During sleep, your blood pressure naturally dips, a pattern known as nocturnal dipping, and your cardiovascular system gets a period of relative rest and repair. When you're sleep-deprived, that dipping doesn't happen properly, and your heart and blood vessels are under increased stress around the clock. Poor sleep is also associated with increased inflammation, insulin resistance, weight gain, and elevated cortisol, all of which harm circulation. If you're struggling with your sleep, Whether it's difficulty falling asleep, staying asleep, or sleeping but not feeling rested, please take that seriously. Sleep apnea, in particular, a condition where breathing repeatedly stops during sleep, is directly connected to high blood pressure, heart disease, and poor vascular outcomes. If your partner has told you that you snore loudly or stop breathing in your sleep, or if you wake up exhausted no matter how long you sleep, talk to your doctor about being evaluated for sleep apnea. It is extremely common, extremely underdiagnosed, and extremely treatable. Now, I want to come back to something I said near the beginning, because I think it's worth reinforcing. I started by talking about how easy it is to dismiss symptoms like leg swelling, and I want to explore that a little more. Why do we dismiss these things? Why do we explain them away? I think it comes down to a few things. First, we're busy. We have 1,000 things demanding our attention, and a slightly puffy ankle doesn't feel urgent. Second, we're uncomfortable with the possibility of bad news. If we ignore it, maybe it'll go away. If we don't get it checked, we don't have to deal with it. Third, we've absorbed a cultural message that tells us to be tough, to not complain, to push through. That message is not serving us. It is genuinely not serving our health. Here's what I want you to take from this. Paying attention to your body is not weakness. It's not being a hypochondriac. It is wisdom. Your body is communicating with you constantly, and learning to listen, and then to act on what you hear, is one of the most powerful health choices you can make. I'm not asking you to live in fear or to catastrophize every sensation. I'm asking you to pay attention, to notice, to follow up on the things that keep coming back, to treat your body with the respect it deserves. And I want you to know something else. Whatever you're experiencing right now, whether it's mild and occasional or significant and getting worse, there is help. There are treatments. There are lifestyle changes that work. There are doctors who can guide you. You are not trapped in a declining health trajectory just because you've been experiencing symptoms of poor circulation. The body has a remarkable capacity to respond to positive change. Blood pressure can be lowered. Arterial stiffness can be reduced. Venous return can be improved. The swelling can go down. The heaviness can lift. But it requires action. It requires the willingness to take your symptoms seriously and do something about them. I want to take a moment here to think about the people who are watching this, who might be doing so for someone they love, a spouse, a parent, a friend, because they've noticed these symptoms in that person and they're worried. If that's you, first of all, let me say that your concern is valid and it is meaningful. Sometimes the people closest to us can see what we can't see in ourselves. If someone you care about has been dismissing swollen legs, cold feet, unusual fatigue, or shortness of breath, it is okay to gently and lovingly raise it. You might not have medical training. You might not know exactly what's going on, but you can say, "I've noticed this, and I care about you, and I think it's worth getting checked." That conversation could be the one that changes everything. I also want to acknowledge that for some of you, getting to a doctor isn't simple. Healthcare access is a real issue. Cost is a real issue. Stigma around healthcare in certain communities is a real issue. If you're facing barriers to getting proper medical care, I encourage you to look into community health centers, which often offer sliding scale fees based on income. Look into whether you qualify for programs that can help with healthcare costs. Reach out to local health departments. Use telehealth options, which have become much more accessible in recent years. I know the system can be difficult to navigate, but please don't let those barriers be the reason you don't get care. Your health is worth fighting for. Now let me leave you with something I think about a lot, because I think it speaks to why conversations like this one matter so much. We live in an era of more health information than has ever existed in human history. We have the internet. We have research. We have doctors and health content creators and books and podcasts. And yet, chronic disease is more prevalent than ever. Cardiovascular disease remains the leading cause of death worldwide. Why is that? It's not because the information isn't out there. It's because information alone doesn't change behavior. What changes behavior is connection, understanding, feeling like someone actually sees you and is speaking to you, not at you, about your health. It's the feeling that someone actually cares whether you take action, And I want you to know that I do care. I care that you understand what your body is telling you. I care that you take your symptoms seriously. I care that you don't become a statistic because you were too busy or too scared or too conditioned to dismiss your own signals. You came to this video for a reason. Something brought you here. Maybe curiosity, maybe a symptom you've been wondering about, maybe someone you love. Whatever it was, I'm glad you're here. I'm glad you're listening. And I hope that something you've heard today moves you to take one step, just one step, toward better understanding and better caring for your circulation, your heart, and your overall health. So let me give you your action items. They're simple. First, if you've been experiencing leg swelling, cold extremities, heaviness, tingling, shortness of breath, or unusual fatigue, please schedule a visit with your healthcare provider and describe your symptoms clearly. Second, start moving more. Even a daily 30-minute walk makes a genuine difference. Third, look at your diet. More vegetables, less sodium, more hydration, more omega-3 rich foods. Fourth, if you smoke, commit to quitting. Reach out for support. Fifth, manage your stress, protect your sleep, take these things seriously. And sixth, and I think this is important, share this video with someone who needs to hear it, because chances are you know someone who's been dismissing a symptom that deserves attention. A word from someone who cares can be the nudge they need, and I want to hear from you. Drop a comment below and tell me, what was the most surprising thing you learned today? What are you going to do differently? Have you been experiencing any of the symptoms we talked about? This isn't just a one-way broadcast. I want this to be a real conversation. Your questions, your stories, your insights, they matter to me, and they help other people in this community too. So please, say something. Let's keep talking about this. Your circulation is your life. Literally. Every beat of your heart, every inch of your arteries and veins, every capillary delivering oxygen to every cell, all of it is working for you, all the time. The least you can do is work for it too. Take care of it, nourish it, pay attention to it, and when it whispers, please, please, listen. Because the cost of not listening is too high, and the reward for listening is more life, more energy, more vitality, more years of feeling well and present and strong. You deserve all of that. So start today. Not tomorrow, today. I'll see you in the next one.